Hello, everybody, and welcome to today's Lunch and Learn program. My name is Krista Catano. I am with Family Partners of Morrison Sussex Counties, and this is Lunch and Learn, where we like to have lunch with local experts. And today is October 28th, 2021. And we're so happy to have you all here with us virtually. Thanks for taking time to have lunch with us. So today we're so excited to have Dana Brodeker with us. I'm going to introduce her in a moment. I'll just go over a few things. We are recording today's presentation so that way we can send it out to you, so you don't have to worry about taking too many notes. And it will be on our YouTube channel, which we have over 50 other videos of different topics online available 24/7 to you. We will send out a follow-up email with all of these resources and any other handouts or slides that Dana has for us. So again, don't worry about taking too many notes. We'll get them out to you. We are so glad that you're here. Feel free to leave your cameras off if you'd like. We know, everyone's having lunch around this time, so no pressure, but we love to see smiling faces too. So if you'd like to turn on your camera, we're always glad to see that. And I think without any further ado, I'm going to introduce Dana Brodeker. She's joining us from the Center for Evaluation and Counseling, and she's a licensed associate counselor with a wide variety of past work. And I'd love, Dana, to hand it over to you and tell us a little bit more about some of your experience and what you've worked with and what you do with the Center for Evaluation and Counseling.
Sure. Thank you, Krista. So as Krista said, I'm an LAC. I just graduated with my master's this past May. I've been at the Center for Evaluation for about a year, including my internship. I mainly work with kids and adolescents. I do work with some adults, but we work on a lot of coping skills, emotional regulation. So we do a variety of things over at CEC. I do have a background in eating disorder population. So this is where a lot of my experience comes in with self-injury or self-harm. And we will also be talking about suicide and how they kind of correlate with each other. So today we're really going to be discussing what self-injury is, who is at risk, correlation between suicide and self-injury as a coping skill and what to do, how to support people who are self-injuring, along with how parents might experience this event happening and how to cope with that and when to get help. So I do have a PowerPoint that I'm going to go off of. So I'm just going to share my screen. All right. So our first topic, like I said, is going to be what is self-injury or self-harm. So, of course, actual definition, self-injury involves a person damaging their body by cutting, burning, scratching, or practicing any other behavior that results in pain or injury. This can be, many different things. Through my personal experience in the professional field, I've seen a range of items people have used to cut or to scratch, which is often a question that I get when people are trying to care for someone who is engaging in self-injury about whether they should limit the type of sharps that they have or anything along those lines. And the answer is that it's really not going to do anything because they're always going to find something, whether that's a nail out of the wall, whether it's a staple, they use their fingers. So really restricting that might not be helpful. Self-injury is a common symptom of many psychological conditions. I'll get into that a little bit later. There's usually an underlying mental health illness that is causing the self-injury and why they're experiencing that. Self-injury is most commonly the result of feeling sadness, distress, anxiety, confusion, and or numbness. A lot of people might also feel empty, and the reason why they engage in this self-harm is to feel something. It's usually used as a negative coping skill to deal with these emotions. And it's usually when these emotions are so intense, they don't know how to regulate them. So most of the time, self-injury happens among adolescents. It's usually when it starts happening, and it can persist into adulthood if it's not treated or acknowledged. Adolescents have the highest rate of self-injurious behaviors, and it often begins around 12 to 14 years old. Females are more likely to self-injure than males. Not sure why, but that is what the statistics say. And it's important to remember that self-injury does not discriminate. It can happen to anyone of any age, gender, race, religion, socioeconomic status, and ethnicity. So some common causes. Like I said before, self-injury is commonly reported when someone feels empty inside, are over or understimulated, are unable to express their feelings, are lonely, and are not understood. Self-injury is their way to cope with or relieve pain from hard to express feelings, and is generally not a suicide attempt, which we'll talk about more in a little bit. So these teens or adults are experiencing intense emotions and they don't know how to regulate that. And injuring themselves has a sense of release there. The relief is temporary. It can often develop in a self-destructive cycle without proper treatment. Self-injury can also be a way to have control over your body when you can't control over anything else in your life, which is a lot of the time why we see it among adolescents. Adolescents don't have a lot of control over their life. They have parents, they have teachers, they have to go to school, they have to do so many certain things. And the control that they have is very limited. So common risk factors are having friends or family members who self-injure. It can be a learned behavior. Most of the time it is not. Experiencing stressful life situations like traumatic events, family instability, and or sexual identity uncertainty. As I said earlier, a lot of mental illness goes around self-injury. So sometimes it can be a symptom of depression, anxiety, personality disorders, eating disorders, or other substance abuse disorders. So some warning signs of people who might be engaging in self-injury. Unexplained injuries, including cuts and burns, low self-esteem, difficulty handling feelings, relationship problems or avoidance of relationships, poor functioning at work, school, or home. And people who self-injure may attempt to conceal their marks. So you will see people wearing long sleeves when it is in the middle of summer, or a sweatshirt or long sleeves. Sometimes they might be wearing baggier clothes to conceal things that are happening. So a couple of myths about self-injury, and I think that this is super important to know, because a lot of the time when we talk about self-injury, people who don't have the experience with it might think these things. And although sometimes it can be true, it's usually not. So self-injury is a suicide attempt. It's typically not a suicide attempt. Of course, there's the exceptions, but it can link to suicide. And we'll talk about that in the next slide. Self-injury is attention-seeking or manipulative. Self-injury is not really a big deal, which we know it is a big deal. There can be a lot of consequences from self-injury. So why do adolescents engage in self-injury? So they want to obtain relief, like we said, from whatever negative feeling that they're having, whether it's overwhelming sadness, anger, confusion, not knowing how to deal with those emotions. They want a relief, a sense of control. And interpersonal difficulty, like a disagreement with a friend or a loved one that they don't know how to deal with it. They don't know how to use any conflict resolution, or communication is another big one. Dealing with an interpersonal problem. So something that's going on with them and they don't know how to express it. To induce a positive feeling state, to punish themselves, or like we said a lot, to feel in control. Speaking off of punishing themselves, with the eating disorder population, the control aspect is the food, and they're restricting or binge eating because they have that control. And then because they're engaging in those behaviors, they sometimes feel like that they might have to punish themselves. So they engage in the self-harm for doing those behaviors of eating or restricting. So that's just an example of how someone would want to punish themselves. So self-injury and suicide, or suicidal ideation. So the relationship between the two can be very, very complicated. Like we said before, self-injury doesn't always mean someone wants to attempt suicide, they have suicidal ideation, but because self-injury can be very significant and severe, it can lead to death or medical complications. Sometimes the harm can be more than what they intended to do because they can't gauge that. In severe and prolonged cases of self-injury, a person may become desperate about their lack of control over the behavior and its addictive nature, which then can also lead to a suicide attempt. So this slide has a lot, but we're going to go through it. As we talked about earlier, self-injury is viewed as a negative coping skill. It's how someone is dealing with whatever is going on in their environment or whatever they're feeling internally. So they could be self-injuring because they're trying to express a need for support. So maybe not even attention seeking, but like, hey, I need help and I don't know how to ask. So there's that communication piece in it. So a replacement positive coping skill is writing a letter, calling or texting a friend to make plans, and expressing those feelings in some way or another instead of engaging in the self-harm or self-injury. To see their pain. Sometimes people want to see the pain that they're experiencing and those intense feelings, and they could engage in self-injury for that. So something to do could be drawing about feelings or journaling about them. To feel in control, which is a huge thing that we've talked about. Positive coping skill for that could be yoga, making a to-do list, cleaning the room, taking a shower, and also allowing choices for the adolescent or the person that you're working with when it seems like they don't have any choices at all. A question that I get a lot is, how can you give them choices if their schedule is so rigid? Well, if they're younger, allowing them to pick out what they want for lunch, allowing them to pick out what they want for dinner, or what time they want to have dinner, what they want to wear, giving them choices and opportunities to do things to feel like they have some control in their life and giving them that control. So to punish themselves. Some ways to get that same sensation is taking a cold bath, dancing, or making a list of something that you're grateful for, which is the opposite of wanting to punish yourself. To stop feeling empty or numb. They might feel numb and they're engaging in this self-harm to feel something. So something that they can do that can awaken their body is aromatherapy, some mindfulness, or grounding. And the exercise that I have up there is the 5, 4, 3, 2, 1 exercise, which puts you in your present moment with your senses. So it can be 5 things you see, 4 things you hear, 3 things you smell, 2 things you taste, and going on. Or in any other version of that. It doesn't have to be those specific things, but just using all 5 of your senses in some way to connect you to the present. Relief from emotional pain such as sadness, anxiety, frustration, and anger. So some positive coping skills for that is walking, listening to music, or journaling. So people engage in self-harm as well because they want to release intense emotions. And here's some things that you can teach this person or adolescent to do to have that same sense of release. I know something that I used to do personally with whoever I was working with in a professional setting was we would take handfuls of ice and throw them at a wall. So they're getting that sensation of the cold and being able to release that anger in an appropriate way to where it's not damaging anything and it's not harming anything. But the same way can be clenching an ice cube in a hand until it melts, or snapping an elastic band against your wrist, drawing on your skin instead of cutting yourself or burning yourself, doing some type of sport or physical activity, using a punching bag, being able to hit a pillow or another soft object, listening to or creating loud music, of course, when appropriate. Another thing that I've heard of people doing is actually taking a pillow and screaming into it because it's going to mute some of that noise, but it's allowing them to get that intense emotion out. So how to support someone that is engaging in self-injury? It is super important to be patient, to learn about self-injury, which is why a lot of you are here. And to address the issue, there's always some type of root issue, concern, problem that is going on that is being exhibited in this self-injury. To validate the person's feelings, or your child, whoever you're working with, and letting them know that it's okay to have these feelings and how to appropriately deal with them. Speaking to your child or whoever you're working with in a calm tone, offer reassurance and be respectful. Check in on how the child is doing regularly. Open communication, trying to build healthy habits, open-ended questions, asking them if they need support in order to stop their self-injury. Maybe a therapist, maybe talking to someone else, a guidance counselor, whoever it might be. And to continue on from that, taking the child seriously. Like we said, self-injury is happening to relieve some type of feelings of stress or overwhelmingness or intense feelings. So it is something that's serious. They're not doing it for attention. They're doing it because they need help with something and they don't know how to express that. Giving praise and, positive praise for all of the changes that they're making. When looking for improvement, look back to a 6-month period rather than focusing on short periods of time, because it's hard to see progress when you're only focusing on day to day or week to week. Looking at that small progress is definitely beneficial, but being able to look at the long-term improvements too, when you feel like things maybe aren't getting better and they really might be. So focusing on the child. Like we said, it's not uncommon for parents to feel overwhelmed. They may also think on what they did wrong. A lot of parents have their own feelings when this happens, and it's important to support them so they can support the child as well. And taking care of yourself, model what good self-care looks like. So whether it's a therapist, a guidance counselor, a parent, kind of, practice what you preach. And that's the biggest thing. If you're telling someone to do all of these great coping skills, make sure you're doing coping skills for yourself. So making sure you're taking care of yourself so you can help someone else. So some things that are not helpful when it comes to self-injury. Thinking of ongoing self-injury as failures. Responding in hurtful ways such as yelling, punishments, insults, or threats, that's going to create more stress and a barrier and have them become really closed off. Fighting for power or control. Like we said, a lot of this is about that power and control. And you can't control another person's behavior. So allowing them to have that control over their body and having it be in an appropriate way. Rationalizing the behavior by thinking that the teen is just going through a phase. Minimizing the seriousness of this behavior. Like we said, it is very serious and there's usually an underlying concern. Isolating the child. And focusing on the self-injury. Concentrate on what is driving the behavior, not the behavior itself. So like we said before, really focusing on why this self-injury is happening and what that root cause is. So some things of what to say and how to talk to someone who is engaging in self-injury. Having a conversation, but not bringing it up right away. Having the conversation around another activity to make light of it, because it is a very heavy topic and it can be very stressful. Ask if anything is worrying them and how they're feeling. Try to elicit some of those feelings and see what's going on. Show that you are prepared to listen. So listen to what the person is saying is bothering them and validating that. If they don't want to talk, see if they'll write a note, an email, or a text message about how they're feeling. I mean, sometimes, even just getting out a piece of paper and pointing to what that person is feeling can be really helpful as well if they aren't ready to talk about it. Seeing if they want to speak to someone else. If the child is open about self-injury, to help them work out the feelings in situations that might be triggering it, or environmental things that are happening. Try to think of ways together to handle the strong feelings that don't involve the self-injury. So going back to the slides that I showed before of positive coping skills that you can replace it with, or ways to release intense feelings. Help them think through their problems and see possible solutions. And letting them know that even if there's something going on in that moment that's very stressful, it might not always be the case. It's not going to be forever. Encourage them to think about the long view and how to change it in the future. So kind of like what I said, doesn't always have to be something that is going to last forever, because life is always changing in everyone's lives. If you look back from last October to this October, very, very different. Or if you look from the beginning of the pandemic to this pandemic, or to now in the pandemic, very, very different. There's constant change all of the time. So what parents might experience, and I think that this is super important as well, because even though the child or the adult are experiencing what they are, parents also have their own reaction and experience to it, and making sure that they are properly, dealing with and coping with what they're experiencing is only going to help support the child in this way. Discovering that the child is self-injuring can be very upsetting and stressful for a parent. They can experience a range of emotions, including anger, sadness, helplessness, shame, or even disgust. They take it very personally, like they did something, or it was their parenting. This is all normal for them to feel that way, and accepting that so they don't misdirect it at the child. It can be very unexpected and highly distressing for parents to get an understanding that their child is self-injuring. They can have difficulties in communication with their child. It can be very hard. Like we said, it's a very sensitive topic, and especially a parent trying to talk to their child about it. The stigma associated with self-injury can cause isolation. Parents might not want to talk to other people about it because they're taking it very personally and like they did something. Trying to think of the behavior as an expression of deep emotions that they can't handle any other way, and it doesn't reflect back onto their parenting skills or what they've done as a parent. So how parents can cope with the experience. They can pay attention to physical signs of stress, stomach aches, change in sleeping patterns, change in appetite, anything like that. Taking time for themselves when they're upset, doing things that they enjoy, learn to identify and accept own feelings, find an outlet for emotions, talking to a friend, relative, therapist, journaling. Some emotions might come out as anger, and making sure that the parent isn't directing that onto the child. Giving the parent permission to do things that really need to be done, but worry about the less important things. Taking time off of work, encouraging them with the self-care and being able to take care of themselves. Like I said before, practice what you preach. If you want a child to do that, make sure parents are doing that. Make sure you're doing that. When to call for help. So if someone displays any signs or symptoms of self-injury, a mental health professional with self-harm experience should always be consulted immediately. An evaluation or assessment is the first step, followed by a recommendation of treatment to prevent the self-destructive cycle from continuing. As we said, it can start and it can progress, and it can progress very quickly if it's not something that is addressed and treated. So this is a resource that I find is really great, which I will send around to Krista as well. I just wanted to add it in here to talk about it a little bit. It has everything that you would really need to know to care for someone that is self-injuring. Especially for parents, it goes through the symptoms, how to take care of, whatever the injury might be, whether it's burns, whether it's cutting, and gives you the support. And it's a really great outline to go off of if you are working with someone, or you working with a parent, or if you're a parent. It's a great resource to have. It's just quick little 6-page pamphlet, but it has so much information in this small area, which is great. We are open for questions.
I think we got them all. So I'm going to thank everyone for coming today. Thank you, Dana, for sharing this valuable information and taking your time to share with us. And we are here every Thursday with a different topic, current experts from all different organizations we try to keep it as current as possible. So just stop by next Thursday, and I believe we're talking about ADD and ADHD. And you can see our full lineup through our emails and also on our website. So thank you guys for coming, and stay safe, and we'll see you next time.